Hundreds of thousands of people in the state that go every day without health insurance. But they're not the only ones suffering in this nation's healthcare crisis, not by far. There are so many Iowans and Americans that have health insurance, but are feeling the burden of skyrocketing healthcare costs get heavier every year. The cost of insurance is keeping America's big businesses from competing globally, and are now keeping America's small businesses from even surviving. As you will hear in the Access Project report, Iowa family farmers, whose products we greatly depend on, are feeling this pinch now worse than ever. Years ago, a farmer might have to sell a piece of his land to pay for medical care. Now he'd have to sell the entire farm. It is inexcusable that in the richest country in the world, so many people can't afford access to health care. The American system is in need of real comprehensive reform, and this change needs to happen at the national level. Today, we've released our presidential candidate health care plan comparison to our 32,000 healthcare voters in the state. We've sent it in the mail to all of our voters, asking them to get out and caucus for healthcare reform, to caucus for the candidate that they think has the best plan to bring quality, affordable health care to every man, woman, and child in this country. The longer we wait, the worse this is going to get. We must act now. We must make this reform a reality. I'd like to now introduce Bill Latero from the Access Project, and he will talk more specifically about the farm brief itself. Thank you.
Thank you, Andrew. Good afternoon. My name is Bill Latero. I'm Field Director for the Access Project and co-author of the report. Excuse me. In 2007, the Access Project joined with the University of North Dakota Center for Rural Affairs and Brandeis University, our long-standing research partner, to gather data about the sources, type, and characteristics of farm and ranch health insurance, as well as the financial burden that the healthcare expense places on farms and ranch families. We collected through an association with the USDA National Agricultural Statistical Service a sampling of over 2,000 non-corporate farm and ranch families across the Great Plains states. Today we're releasing a subset of that data, which is Iowa specific. It's 13% of the total capture of that data. And of that, some of the particulars which are very important. On a chilly day, some of these facts are quite chilling. We have an average income of the families that we surveyed had an income of between $40,000 and $100,000. So they are solidly middle class. They were also over 90% insured. That is, they are playing by the rules and hoping to gain financial protection for the money they spend on the health insurance. Well, how much do they spend? On average, $6,500. It's an awful lot of money per year. That is for premiums, deductibles, co-pays, and out-of-pocket expenses, not including dental. We exclude dental because we're going to study that separately. Now, where do they purchase this? They, as you know, farm families have a spouse, someone on the family farm that goes off and out off-farm employment oftentimes. They often have said in the report that we, during the gathering of this information, they frequently stated that the reason they go off-farm is to secure health care because it's too costly to get it on the individual market. On the individual market side, 37% of the sample of Iowan farmers had to purchase their health insurance on the individual market. That is by far staggeringly higher than the average U.S., which is 8%. So either you can get it through your spouse's employment, and if you're lucky, or you must purchase it on the individual market. A few, small percentage of the sample got it because they were veterans association, and they got it through the government sponsored programs. However, of those that secured it on the individual market, they're spending much higher than the average. They're securing a high deductible, high premium plans more often than not, and they're spending on average $10,500. So when you look at the cost differences between those who secured it on the individual market, it was $3,600 for more than somebody who got it through a government-sponsored program, and $3,900 from somebody who got it through a spouse's off-farm employment. These are very, very high numbers. One in, excuse me, 1 in 6 said that the securing of this health insurance had caused some significant financial problems for the family. And 1 in 8 had actually medical debt. That is being insured and still having unpaid bills. Now that mars your credit, your inability to invest in your farm operation. This is an important issue. We're trying to reveal the details that the cost of health care is going up and up. It is impacting solidly middle class, solidly hardworking individuals, and that the costs that we were just mentioning are only going to go up because year in, year out, there is no cost containment in any of the strategies so far, which means that on a year in, year out basis, those costs will continue to spiral upward. This is a train wreck, and we're looking to have presidential candidates and state leaders grapple with some fundamental issues to come up with a plan that offers high quality, valued product in a cost containment strategy. And now, for a personal side of that story, I'd like to introduce Chris Peterson, who is president of the Iowa Farm Bureau. Thank you.